Hey there, everyone. We're diving deep today. Get ready for it into the 2024 European Association of Urology Guidelines, that's EAU guidelines for short, on non-neurogenic male lower urinary tract symptoms. LUTS.
You got it.
You specifically requested this deep dive, wanting to get up to speed on, diagnosing, treating, and managing this pretty common condition. And don't worry, we'll cut through all that medical jargon, all the complicated stuff, and deliver those key takeaways you're really looking for.
You're in the perfect place for that.
Yeah.
These EAU guidelines, they're really the gold standard for healthcare professionals all over the world.
Okay.
Think of it as the most up-to-date handbook on LUTS. Actually, they've been around since 2000 and they get updated every year. So we're dealing with the latest and greatest information here.
That's really reassuring to know, especially when you're, thinking about something as important as your health. So first things first, what exactly are LUTS? Is it just a fancy way of saying prostate problems?
Yeah, that's a really common misconception. While LUTS, can be caused by prostate issues, it's actually a much broader term. It includes, a whole bunch of symptoms that affect the lower urinary tract. And that includes, the bladder, the prostate, and the urethra, which is the tube that carries urine out of the body.
Oh, okay. So it's not just about the prostate. What are some common examples of LUTS? What would that sound like or feel like?
So think about those times when you feel like you have to go to the bathroom all the time, or you feel like you have a weak urine stream, or maybe you have trouble starting or stopping your flow, or maybe you just, you don't feel like you've completely emptied your bladder. All of those are classic LUTS, and they can really significantly impact your quality of life.
Yeah, that makes sense. It definitely sounds like more than just, a minor inconvenience. So the guidelines, they mentioned something called benign prostatic obstruction, or BPO. Is that the same as BPH, benign prostatic hyperplasia? I always get those two mixed up.
Yeah, it's really easy to confuse those two. So BPH, that just means that you have an enlarged prostate, which is very common as men age. But BPO, that refers to the actual blockage of urine flow because of that enlarged prostate. So think of it like this. BPH is like the underlying condition, and then BPO is one of the potential consequences.
Okay. So BPH can lead to BPO, which then causes those pesky LUTS. What else can cause these symptoms? Is it just those two things, or are there other things to be aware of?
Yeah, so apart from the prostate, bladder dysfunction is another major culprit. And this could be an overactive bladder, meaning that your bladder muscles contract way too often, which leads to that frequent urination and that urgency. Or it could be an underactive bladder, which means that your bladder muscles they don't contract strong enough, which makes it really hard to empty your bladder completely.
Wow, so there's so many possibilities there, it seems like. Figuring out the root cause is really crucial for getting the right treatment.
Absolutely. And that's why these guidelines, they really emphasize a step-by-step diagnostic process. It's almost like detective work, really.
I like that analogy. So how do doctors go about solving this LUTS mystery? What's the first step?
So the first thing they want to do is get information from you. So they'll probably ask you to fill out a symptom questionnaire. And a common one is called the International Prostate Symptom Score. You'll probably see it as IPSS. And don't let that name intimidate you. It's really just a simple checklist that helps to quantify your symptoms.
Yeah.
And it gives your doctor a clearer picture of what you're experiencing.
So it's like a rating system for your LUTS.
Exactly. And then they'll also want to know about your medical history, any medications you're taking, and also your lifestyle habits. And this is where those bladder diaries come in handy. They can really give some valuable insights into your voiding patterns, how much fluid you're taking in, and any potential triggers for your symptoms.
I've heard about these bladder diaries, but I never really understood their purpose. What do you actually track in a bladder diary?
Think of it as a detailed log of your bathroom habits, right? It really helps to track things like how often you pee, how much urine you're actually producing, and if you're experiencing any leakage or any urgency. And this information, it can be incredibly helpful in really pinpointing the cause of your LUTS. Yeah. So for example, if you're getting up a lot at night to pee, the diary might reveal that you're just, drinking too many fluids before bed. Or it could indicate, an underlying medical condition.
That makes a lot of sense. So So we've got the questionnaires, we've got the diaries. What other tools do doctors use to kind of get to the bottom of this LUTS, issue?
Well, a physical exam is really essential, and that includes a digital rectal exam.
Mm.
And this allows the doctor to actually assess the size and the shape of your prostate. And I know it might sound a little bit uncomfortable, but it's really a very quick and important part of the evaluation.
Yeah, yeah, I can see how some men might be apprehensive about that, but it's better to have a little discomfort than to miss out on important information.
Absolutely, absolutely. And then they'll also do a urinalysis, which is a simple test that checks for any signs of infection or other abnormalities in your urine. And then depending on your age and risk factors, they might also order a PSA blood test.
Right, right. The PSA test, that's the one for prostate cancer.
Yes, that's correct. Yeah. And we won't be delving into prostate cancer in this particular deep dive, but
Yeah.
it's definitely something that you should, discuss with your doctor during your evaluation.
Yeah, yeah, for sure. So we've gathered all this information now. We've got the symptoms, we've got the medical history, the exam findings, the lab tests. What what happens next? Is it treatment time?
Yeah, yeah, you got it. But before we jump into the treatment, there's one more important piece of the puzzle that we have to figure out, and that's determining the severity of your LUTS. So remember that IPSS questionnaire that we talked about, that score, along with your overall health and your preferences, it helps to really guide the treatment decisions.
Okay, so it's not a one size fits all approach. It really depends on the individual.
Absolutely not. No, treatment for LUTS is
Oh,
highly individualized. It's
sure.
it's all about finding the best solution for you, for your specific symptoms and your lifestyle.
Okay, I'm really starting to appreciate this personalized approach. So tell me more about these treatment options. What are the different things that are available?
Well, the good news is that there's a whole range of possibilities, and it starts with simple lifestyle changes, and then it goes all the way to medications and even in some cases surgical interventions. But the key here is to always start with the least invasive options first, and then you kind of move up that ladder as needed.
Okay, that makes sense. Start slow and steady. So let's start with the basics. What kind of lifestyle changes can actually make a difference for LUTS?
Well, you'd be surprised at how big of an impact simple tweaks can have. So, for example, reducing your fluid intake, later in the evening, that can significantly reduce those nighttime bathroom trips. Also, managing constipation, that can be helpful because a full bowel, it can actually press on your bladder, and that can worsen your symptoms.
Wow, I never would have thought about that, about the connection between constipation and LETS.
Yeah, it's one of those hidden factors that people often overlook, and even being mindful of certain medications that can have urinary side effects.
Yeah.
Like some decongestants or antihistamines that can actually make a difference as well.
So it's all about those everyday habits, really. Are lifestyle changes usually enough to manage LUTS, or do most men end up needing medication?
Yeah, so it really depends on the individual and how severe their symptoms are. Sometimes lifestyle changes are all that's needed, especially if your LUTS are mild, and they're not really causing any major disruptions to your life. But if your symptoms are more bothersome or if they just don't improve with those lifestyle modifications, then your doctor might suggest medications.
Okay, okay. What kinds of medications are used for LUTS? Are we talking about like a magic pill that makes it all go
Yeah.
away?
Oh, I wish it were that simple. There's no single magic pill for LUTS.
Yeah.
But there are different types of medications, and they each work a little bit differently, depending on the specific symptoms and the underlying cause.
Oh, wait, so it's a more targeted approach. What are some of the main like types of medications that are used?
Yeah, so a common category are called alpha blockers, and these relax the muscles in the prostate and in the bladder neck, which makes it much easier to urinate.
Yeah.
And another category are called 5-alpha reductase inhibitors, and these actually work by shrinking the prostate over time.
Okay, so the alpha blockers are more for immediate relief, and then the 5-alpha reductase inhibitors are for more of a long-term solution.
Exactly, exactly. And then we have medications that are specifically for overactive bladder, like muscarinic receptor antagonists or beta-3 agonists. And these help to calm down those overactive bladder muscles and reduce that urgency and frequency.
Okay, that sounds like a huge relief for those, dealing with that constant urge to go. Are there any other types of medications that are commonly used for LUTS?
Yeah, there are. So we also have medications like phosphodiesterase 5 inhibitors or PDE5Is for short. And you might recognize those because they're also used to treat erectile dysfunction. But they can also help with LUTS because they improve blood flow and relax the muscles.
Interesting. So a medication that has dual benefits. I'm guessing that with any medication, though, there's always the potential for side effects.
Oh, you're absolutely right. It's so important to have an open and honest conversation with your doctor about the potential benefits and the risks of any medication before you actually start treatment. They'll consider your overall health, other medications that you're taking, and your individual preferences to determine the most appropriate choice for you.
So it's a real collaborative decision-making process. Speaking of choices, I know that some men might be wondering, what about surgery? When does that come into play?
So surgery is usually considered a last resort.
Okay.
It's reserved for cases where other treatments haven't provided enough relief or when there's a significant blockage. And I know it's understandable to be a little apprehensive about these invasive procedures, but it's important to remember that surgical techniques have really advanced a lot in recent years.
So it's not the same surgery that your grandfather might have had, decades ago.
Absolutely not, no.
Right.
A lot of these procedures are now minimally invasive, and they use these tiny instruments and cameras that are inserted through the urethra. And this means that there's less pain, there's quicker recovery times, and there are fewer complications.
That's reassuring to know. What are some of the surgical options that are available for LUTS?
So there are several, and the choice really depends on things like the size of your prostate, the severity of your symptoms, and your overall health. But one common procedure is called transurethral resection of the prostate. You'll see it as TURP. And this involves removing excess prostate tissue that's blocking that urine flow.
Terpenia, I've heard of that one. Are there any newer, less invasive options available these days?
Absolutely. Yeah, so laser surgery is becoming more and more popular for treating LUTs. It uses this high energy laser to actually vaporize or remove prostate tissue. And it's often associated with less bleeding and a faster recovery than the traditional TURP. And then there's also prostatic urethral lift, or PUL, and that's a minimally invasive procedure that actually uses these tiny implants to lift and open the obstructed urethra.
So many options to consider. It sounds like the key is finding a urologist that you really trust and having a thorough discussion about the best course of action.
You're absolutely right. Yeah, it's a partnership between you and your doctor to determine the most effective and the least invasive approach to managing your LUTS.
Yeah, that's great advice. Well, we've covered a lot of ground in this first part of our deep dive on LUTS, from understanding those basic symptoms and causes to exploring those various diagnostic tools and treatment options. I'm already feeling much more informed. I hope our listener is too. But before we move on to the next part of our deep dive, I'm curious from your perspective, what's the most important takeaway for men who might be experiencing LUTS?
Oh, that's a great question. I think if I had to choose one key message, it would be this: don't suffer in silence.
Hmm.
LUTS, it's common, but it's not something that you just have to live with. With early diagnosis and appropriate treatment, you can really significantly improve your quality of life.
That's a really powerful message, and it's a great place to wrap up this part of our deep dive.
Indeed. So in the next part, we'll delve into the specific challenges of male urinary incontinence and underactive bladder.
Sounds fascinating. We'll see you there. Welcome back to our deep dive into the world of male LUTS. We've already covered a lot of ground, but now I'm really curious to kind of explore a specific aspect that can be, quite sensitive and often overlooked, and that's male urinary incontinence.
Yeah, it's definitely an important topic to address. While it's not always directly related to LUTS, it can certainly coexist and add another layer of complexity.
Yeah, for sure. From what I understand, there are different types of incontinence, right? I've heard terms like stress incontinence and urge incontinence. Can you break those down for us a little bit?
Absolutely. So stress incontinence, That's the type where you leak urine during physical activities that put pressure on your bladder. Things like coughing, sneezing, laughing, or even lifting heavy objects. And it's often caused by weakened pelvic floor muscles or issues with the sphincter muscle, that muscle that controls the urine flow.
So it's like a little bit of leakage when you least expect it. What about urge
So
incontinence?
urge incontinence, that's characterized by a sudden, very intense urge to urinate that you can't always control. And it's often associated with an overactive bladder where your bladder muscles are contracting involuntarily,
Mm.
leading to those, got to go now moments.
Yeah, those both sound incredibly frustrating and potentially embarrassing. How do doctors kind of figure out, what type of incontinence someone is dealing with?
So the detective work, it always begins with a very detailed medical history and physical exam. So they want to know about your symptoms, how long you've been experiencing them, and any potential triggers. And just like with LUTS, those bladder diaries that we talked about earlier, they can be incredibly valuable for tracking patterns and identifying potential causes.
Okay, so it's back to those trusty bladder diaries. Are there any specific tests that are used to diagnose incontinence?
In some cases, yes. So your doctor might recommend something called urodynamic testing.
Mm.
And that's basically a series of tests that assess how well your bladder, your sphincter muscles, and your urethra are actually functioning. It helps measure things like bladder capacity, pressure, and flow rate.
Okay, sounds a bit more involved than the other tests that we've discussed.
It is, yeah, but it can provide really valuable information, especially if your incontinence is severe or if it developed after things like prostate surgery or other treatments.
Okay, that makes sense. So once the type and the cause of incontinence are determined, what are the treatment options? Are they similar to the treatments for LUTS?
So there's definitely some overlap, but the focus is really specifically on regaining bladder control.
Hmm.
And the good news is that there's a wide range of treatment options available, and the approach is again highly individualized.
Yeah, that personalized approach, it seems to be a recurring theme in urology.
Hmm.
So what are some of the first line treatments for incontinence? Where do we start?
So conservative measures are often the first step, especially if your incontinence is mild.
Yeah.
And lifestyle changes, similar to what we discussed for LUTS, they can make a big difference.
So those simple tweaks, they can help with both LUTS and incontinence.
Absolutely, yeah.
That's good to know. What specific changes are we talking about? What should people be doing?
So things like cutting back on fluids before bed or avoiding bladder irritants like caffeine and alcohol, that can be helpful. Weight loss, if you're overweight or obese, that can also reduce pressure on your bladder, and that can improve symptoms as well.
Okay, makes sense. But I'm guessing it's not just about what you drink or eat.
No, you're right. Another key component is pelvic floor muscle training. And you'll probably know it as Kegel exercises.
Kegels. I thought those were only for women.
Yeah, that's a common misconception.
Hmm.
Pelvic floor muscles, they're equally important for men. They help to support the bladder and they help to control urine flow. And strengthening these muscles can significantly improve bladder control, especially for stress incontinence.
Okay, so it's like a workout for your bladder muscles. How do you even do a Kegel exercise?
So it's all about finding the right muscles. Imagine that you're trying to stop yourself from passing gas
Yep.
or interrupting your urine stream, mid-flow. Those are the muscles that you're targeting. And the key is to squeeze and hold those muscles for a few seconds and then relax.
Okay, sounds simple enough, but I'm guessing consistency is key here.
Absolutely. Like any exercise, it takes time and it takes effort to see results. And your doctor or a physical therapist, they can actually teach you the proper technique and help you develop a personalized exercise plan.
Okay, so it's worth seeking out some guidance to make sure you're doing it right. Are there any other non-invasive treatments for incontinence?
Yes. So behavioral therapies like bladder training, they can be very effective as well. And this involves techniques like scheduled voiding. And that's where you gradually increase the time between your bathroom breaks. You're kind of retraining your bladder.
So it's like setting a timer for your bathroom breaks.
Exactly. Yeah. It,
Yeah.
it helps you to establish a regular voiding pattern and reduce those urgent urges. Another technique is called urge suppression. And that involves learning strategies to distract yourself and suppress those sudden urges to go.
Okay, so it's like a mind over matter approach. Are those techniques usually enough to manage incontinence, or do men often need medication?
It really depends on the individual and the severity of their symptoms. For some, those lifestyle changes and the behavioral therapies are sufficient. But if they don't provide adequate relief, then medications can definitely be added to the treatment plan.
Okay, so medications are kind of the next step up the ladder. What kinds of medications are used for incontinence?
So for urge incontinence, medications like those that we discussed for overactive bladder, things like muscarinic receptor antagonists or beta-3 agonists, they can be really helpful. And they work by calming down those overactive bladder muscles.
Okay, so the same medications, just used for a different purpose. What about stress incontinence? Are there specific medications for that type?
So there are. One option is duloxetine,
Hmm.
and that's actually an antidepressant medication. But it's also been found to be effective for stress incontinence in some men. But it's important to note that this is considered an off-label use.
Hmm.
So meaning that it's not specifically approved for incontinence, but doctors can still prescribe it if they deem it appropriate.
Off-label use, that's interesting. So it's important to really have a conversation with your doctor about the potential benefits and the risks of any medication, especially if it's being used off-label.
You're absolutely right. It's all about weighing the pros and the cons
Yeah.
and making an informed decision together.
Yeah, absolutely. Okay, so we've talked about lifestyle changes, we've talked about behavioral therapies, we've talked about medications. But what happens if those approaches just aren't successful in managing incontinence? Is surgery ever an option?
Yes. So in some cases, surgery might be considered, especially for stress incontinence that hasn't responded to other treatments.
Okay, what are some of the surgical options that are available for male incontinence?
So one option is a male sling. And that's a minimally invasive procedure where a sling is placed under the urethra to support it and prevent leakage during activities that increase abdominal pressure. Another option is an artificial urinary sphincter. And that's a device that's implanted around the urethra to help control urine flow.
Okay, those both sound like more involved procedures. How do doctors decide, which surgical approaches is best?
So it really depends on a variety of factors, including, the type and the severity of your incontinence, your overall health and your individual preferences. And they'll really sit down with you and they'll discuss the potential benefits and risks of each option to help you make an informed decision.
So it's back to that collaborative decision-making process that we talked about earlier.
Exactly. Yeah. It's essential to have open and honest communication with your doctor to determine the most appropriate course of action.
That's a great reminder. Well, we've covered a lot of ground on male urinary incontinence, but the guidelines, they also mention something called underactive bladder, which sounds kind of like the opposite of overactive bladder.
Yeah, you're right. It is.
Yeah.
So while an overactive bladder, it contracts too often, an underactive bladder just it doesn't contract strong enough, and that makes it hard. Empty completely.
So instead of those frequent trips to the bathroom, you might have trouble going at all.
Precisely.
Yeah.
And this can lead to a whole range of symptoms, including, a weak urine stream, straining to urinate, and a feeling of incomplete emptying, even after you've just gone.
It sounds like underactive bladder could be easily mistaken for BPO,
Yeah.
making it difficult to pee.
You're right. The symptoms can be very similar, which is why, proper diagnosis is really important. And doctors they'll use a combination of tools to differentiate between the two, including things like medical history, physical exam, urinalysis, and those urodynamic tests.
Okay, so how do urodynamics help to differentiate between the two?
So urodynamic testing, it can actually measure the pressure that's generated by the bladder during urination. So in underactive bladder, the pressure is weak, and this indicates that the bladder muscles they're not contracting forcefully enough. But in BPO, the pressure is usually higher, but the flow of urine is obstructed, which suggests that there's a blockage.
So it's like the difference between a weak pump and a clogged pipe.
Yeah.
That's a great analogy. So once underactive bladder is diagnosed, how is it treated?
So the focus of treatment is really on improving bladder emptying. And sometimes simple lifestyle changes like double voiding that can be helpful.
Yeah.
And that just involves trying to pee again a few minutes after you think you're finished, just to make sure that your bladder is completely empty.
Double voiding. I've never heard of that. Are there any other lifestyle changes that can help with underactive bladder?
Yes. So pelvic floor muscle relaxation techniques can also be very helpful.
Wait, relaxation techniques? Didn't we just talk about like strengthening those muscles for incontinence?
You're right, we did. But with underactive bladder, the problem is often that those pelvic floor muscles are too tense.
Mm.
And this can interfere with bladder emptying. So in this case, the goal is to actually learn how to relax those muscles and allow the bladder to empty more effectively.
It seems like those pelvic floor muscles, they play a really crucial role in so many aspects of bladder function.
Absolutely. Now, in cases where lifestyle changes and those relaxation techniques aren't sufficient, then something called clean intermittent catheterization, or CIC, might be recommended.
Gee, I see. That's where you use a catheter to drain the bladder yourself, right? Isn't that a little bit intimidating for some people?
It can be. It can be initially, but it's a very safe and effective way to ensure that the bladder is emptying fully.
Yeah.
And it helps to prevent complications like urinary tract infections. And doctors and nurses can teach you the proper technique.
Yeah.
And with a little bit of practice, it becomes routine.
So it's like taking control of your bladder health. Are there any other treatment options for underactive bladder if CIC isn't feasible?
Yes. So there are medications that can actually help to stimulate bladder contractions, making it easier to urinate. And then in some cases, surgery might be considered, especially if there's an anatomical issue that's contributing to the problem. But those are typically reserved for more complex cases.
Okay, so just like with other urological conditions, there's a whole range of treatments available for underactive bladder, from those conservative measures to more invasive interventions.
Exactly. And the choice of treatment really depends on the individual's, situation and their preferences.
Right. So we've covered LUTS, we've covered incontinence, we've covered underactive bladder. Is there anything else that men should be aware of when it comes to their urinary health?
So one more common issue that often comes up, especially as men get older,
Right.
is something called nocturia, and that's basically getting up at night to urinate.
Nocturia. I've definitely heard of that. Is it always related to prostate problems?
Not necessarily. So while an enlarged prostate can contribute to nocturia, it's just one piece of the puzzle.
Hmm.
Nocturia can also be caused by, drinking too much fluid before bed, by certain medications, sleep disorders, and even some medical conditions like diabetes or heart failure.
Wow, so many possibilities. It seems like a bladder diary would be helpful in this case too.
You're absolutely right. Yeah, a bladder diary can really help to track your fluid intake and your urination patterns, which can provide really valuable clues about the underlying cause of your nocturia.
So once the cause is identified, how is nocturia treated?
So just like with the other conditions that we've discussed, the treatment for nocturia, it really depends on the underlying cause. So if it's related to fluid intake, simply reducing your fluids before bed, that can make a big difference.
Okay, that makes sense. But what if it's not just about too much water before bedtime?
Yeah. So if you're dealing with something called nocturnal polyuria, which is a condition where you're producing excessive urine at night, then your doctor might recommend medications that help to actually reduce urine production. A common one is desmopressin.
Desmopressin, I've never heard of that one. How does that work?
So it's a synthetic version of a hormone that regulates water reabsorption in your kidneys, and basically it helps your body hold on to water instead of sending it to your bladder,
Yeah.
and that helps to reduce the amount of urine that you're producing overnight.
That's fascinating. It sounds like a real game changer for those dealing with that excessive nighttime urination. Are there any other treatment options for nocturia?
Yeah, so if your nocturia is related to an overactive bladder, then medications that relax the bladder muscle can be helpful, and in some cases even medications that are used for BPO, like alpha blockers, they can improve nighttime urination by reducing prostate resistance.
Okay, so once again, it's all about targeting that underlying cause. But what if the nocturia is linked to a sleep disorder, like sleep apnea?
So in those cases, treating the underlying sleep disorder is really crucial. So for example, using a CPAP machine for sleep apnea, that can significantly improve your sleep quality, and that can actually reduce nighttime urination.
It seems like everything is kind of connected. So before we move on to the final part of our deep dive, what's the most important takeaway for men experiencing nocturia?
So the key message here is don't ignore it.
Hmm.
Nocturia, it can significantly impact your sleep and your overall quality of life. So talk to your doctor, you know, determine the underlying cause and explore those various treatment options that are available. You don't have to just accept it as a normal part of aging.
Yeah, that's great advice. Well, we've covered a lot of ground in the second part of our deep dive, exploring those challenges of male urinary incontinence, underactive bladder, and nocturia. I'm feeling much more knowledgeable. I hope our listener is too.
Me too. And so in the next part, we'll shift our focus to the importance of patient empowerment and shared decision making in urological care.
Sounds like a great way to wrap up our exploration of the EAU guidelines. We'll see you there. Welcome back to the final part of our deep dive into the EAU guidelines on male LUTS. We've explored the symptoms, the causes, the treatments for a whole range of urological conditions. And I have to say I'm feeling much more empowered just having this knowledge now.
Yeah, I agree. Knowledge is definitely power, especially when it comes to your health. And that's exactly what we want to emphasize in this last part, the importance of being an active participant in your healthcare journey.
Okay, that sounds like a perfect way to kind of wrap up our exploration of the guidelines. So what does it mean to be an active participant, especially when you're dealing with something as sensitive as urological issues?
Well, it starts with being proactive about
Yeah.
your health. Pay attention to your body, notice any changes, and don't hesitate to seek medical advice if something just doesn't feel right. Don't dismiss symptoms as just getting older or something that you just have to live with.
So it's about advocating for yourself and really taking charge of your well-being.
Exactly. Yeah. And once you're under a doctor's care, being an active participant means being open and honest about your symptoms, your concerns, and your preferences. Don't be afraid to ask questions and make sure that you understand the treatment plan, including those potential benefits and risks.
Yeah, it's like a partnership between you and your doctor working together to find the best solution.
Precisely. It's a shared decision-making process.
Yeah.
And that includes, adhering to the treatment plan, whether it's, taking your medications as prescribed, making those lifestyle changes, or doing those pelvic floor exercises regularly.
Yeah, consistency is key, as we've heard before. But it's not just about blindly following instructions, right? It's also about paying attention to how you're responding to the treatment and communicating any changes or concerns to your doctor.
Oh, absolutely. Yeah. It's an ongoing dialogue. Your feedback is really crucial for your doctor to fine-tune the treatment plan and make sure that you're getting the best possible care.
Speaking of ensuring the best care, let's circle back to those EAU guidelines and their role in all of this. How do they actually translate into better care for patients?
So they really serve as a roadmap for healthcare professionals. They're providing evidence-based recommendations for the diagnosis, the treatment, and the follow-up of these various urological conditions. And they really help to standardize care and ensure that patients are receiving the most up-to-date and effective treatments available.
So it's like having this trusted guidebook based on the latest scientific knowledge to help navigate those complexities of urological care.
Exactly. And the EAU guidelines are constantly being updated as new research emerges, so you can feel confident that the recommendations are really based on the best available evidence.
Yeah, that's definitely reassuring to know. But it's not just about doctors blindly following guidelines, right?
You're right. Yeah, guidelines are meant to be a framework, not a rigid set of rules. Clinical judgment and individual patient preferences, those are still paramount.
So it's about using those guidelines as a tool alongside experience and personalized care to achieve those best possible outcomes.
Precisely. And that's why it's so important for patients to be informed and to be engaged in their healthcare journey. The more you understand about your body and the available treatment options, the better equipped you are to make informed decisions and to advocate for your own well-being.
Well said. Well said. This deep dive has been a really fascinating exploration of the EAU guidelines on non-neurogenic male LUTS. We went from understanding those basics of these common conditions to unpacking those complexities of diagnosis, treatment, and long-term management. I feel like we've given our listener some really valuable knowledge to empower them to be active participants in their healthcare.
I agree. And as we wrap up, I'd like to leave our listener with one final thought. Remember, you're not alone in this journey. Healthcare professionals are there to guide and support you, at every step of the way. Don't hesitate to reach out to your doctor with any questions or concerns.
Yeah, that's a great reminder. Thanks for joining us on this incredible deep dive.
It's been a pleasure.
Until next time, stay curious and stay informed.